Hey, good afternoon, everybody. Welcome back to our second interview for today. Again, I'm Dr. Shaan from Vitality Chiropractic, having this interview series of vital interviews to go through with other healthcare professionals, the kind of work they do, their stories, and of course, the people that they help. So for today, our guest is Dr. Albert. He's from Allwell Chiropractic here in Singapore. Dr. Albert and I met when we were practicing in Jakarta. He is currently a scoliosis specialist with his patients flying from around Southeast Asia for his care and, of course, for his 2-week intensive programs. Albert, how are things going?
Good, good. Thank you for having me.
Appreciate you being here. So before we start today, for anyone who's not been, say, to a chiropractor before, how would you explain chiropractic to them?
Well, chiropractic is, we chiropractors, we consider as a neuromuscular, skeletal, and posture, as well as movement of the body expert. So we're looking at human body, their biomechanics, their function, their dysfunction, that may, usually this is the one that will cause the problem in our daily activities. So in general, chiropractic, it described as treating by hands. So basically, we're treating the spine using a manual treatment such as chiropractic adjustment. But that's pretty much the older method. But since nowadays chiropractic has evolved, and then a few decades later, I think it's around 1990s, there's a lot more things that involving chiropractic. Nowadays, chiropractors use X-rays to find out what's going on, to find out the root cause of the problems. Even X-ray itself has evolved into a digital motion X-ray, to be more precise in what's going on with the spine. So chiropractic, pretty much a combination of finding the root cause. The X-ray will tell us the story of the spine, and then also, in addition, by adding different kind of treatment plan, rehabilitation, neuromuscular reeducation, nutritional modification, and supplementation, it becomes one realm of chiropractic. And every doctor of chiropractic, like you're doing upper cervical, you're specializing in upper cervical, I'm doing scoliosis treatment. So we are having our own specialty. So basically, we're trying to help each individual to reach their well-being.
So you mentioned, of course, about scoliosis. For some people, that may seem like a word they've never heard before. How would you explain a scoliosis to somebody who's never heard of this term in the past?
Well, if you Google it, the word scoliosis means sideways bending of the spine. And that's pretty much has been used for orthopedic, even just a person that never experienced or having scoliosis, they always mention, oh yeah, you have scoliosis. So whether is it a C curve or an S curve, that's pretty general. In my opinion, that explanation is pretty broad, and that will lead to misconception of the word scoliosis, including the treatment of it. In my opinion, scoliosis, it's pretty much central nervous system, which is consisting of brain and spinal cord. It becomes imbalanced. And the central nervous system that has an imbalance will cause the body to become lack of coordination. And then also it will lead to imbalance of the body biomechanic, that causing our body to compensate. Now, when the body is compensate, we will start doing our movement, for example, like sitting, standing, walking, running, lifting, jumping, and so on, that eventually causing our body to twist. And that twisting motion will starting to cause our deep muscle inside our spine to become twisted as well. So if our body is twisting and the twisting becoming severe, once the body is bending more than 10-degree Cobb angle, so Cobb angle is a method of measuring scoliosis, then we will consider to become scoliosis. And as we grow, as we for example, you're going into puberty, then the scoliosis can become progressive, and that's how the treatment comes in.
So you mentioned about the central nervous system being affected. What do you think are some of the main causes or reasons for that injury to the central nervous system that eventually becomes a scoliosis?
Well, there's many things that can cause central nervous system injury. For scoliosis, the main cause of the problem definitely, well, we still don't know. That's why they call it adolescent idiopathic scoliosis. But there are many, we call it functional scoliosis. What that means is our movement can cause scoliosis. I have many patients, for example, like just have a severe back pain, just have a severe slip disc. And when I find out after taking x-ray, they do have scoliosis, even though it's only like 15, 20 degree, but it caused them extreme problem, extreme symptoms that lead to scoliosis. So central nervous system will adapt to what's going on to our biomechanics. And once the biomechanic becoming very much misconcepted, and the body will becoming misdirected, and that's how it leads to scoliosis.
Yeah, I'd always kind of think of it, it's like if there's a problem in a house in your foundations, it doesn't just affect the foundations, your floors, walls, ceiling,
Yes,
everything
exactly.
becomes crooked. There's then finding what that problem is in the foundation, of course, itself.
Yeah.
What drew you more towards this kind of issue? Because I know a lot of chiropractors, of course, will deal with, say, most commonly chiropractors deal with things like neck pain and back pain.
Yep.
Like you said, we have our own specialties. What drew you towards scoliosis?
Well, when I start practicing, I also see neck pain, back pain, headache, general condition. But so when I moved to Indonesia from the US, I started seeing more scoliosis condition. So my first scoliosis patient, it's 11 years old boy, and he doesn't have much problem. But the parents mentioned to me that, yeah, he has a weird behavior. And when I noticed his weird behavior is he's always twisting his neck, like moving like that. And so I asked him, well, the parents first telling me that, yeah, we're worried that he may break his neck. So, oh, okay, fine. So I asked the boy, like, so do you feel any pain, any discomfort? He said, no, I don't feel anything. So I in the beginning, I have no idea what I'm dealing with. So I did some examination. I took x-ray. I noticed that he has a mild scoliosis, but in the upper neck area. So after I give him, at that time, I started, it's my beginning of a clear institute learning process. So I start treating them, doing a specific measurement according to the clear method, and then treating them according to clear treatment. And then after a few months, I noticed that his subconscious movement, twisting his head, is gone. So I asked him, so how do you feel? Oh yeah, I feel better. Back then, I have to keep moving because I don't feel comfortable if I don't move my neck. I feel more loose. I feel more like lighter in my neck. But after a few months treatment, I feel like I don't need to move my head. I don't need to do that. So after that, I started to see more scoliosis condition in Indonesia, and I noticed that over there's a lot of cases that is getting pretty much untreated scoliosis condition, and they the patient as well as the parents don't know what to do. They always being diagnosed, okay, if you have scoliosis, either you're going for a bracing or surgery, spinal surgery. And of course, parents are very reluctant to go for surgery because it's going to be a lifetime. And so after that, I start learning more and more about scoliosis condition, because the symptom of scoliosis is not just a crooked spine. I have patient that came in. She has her brace on 24/7, and she's also taking Panadol religiously just to get rid of the pain. And she's having depression. She's angry all the time. She's blaming herself, the parents. Why am I having this? It's really sad because the parents also almost give up on her. So after treating her, I feel that, I still keep in touch with her. She noticed that she told me that, I went to college now. I feel happier. I don't experience much pain. And then, with the treatment and the exercise, that specific exercise that I gave her, she feels that she is a new person. So it's kind of like, oh, wow. It's not just neck pain and back pain. Changing someone's well-being is very important. Just to improve their condition through scoliosis, spinal changes.
And tell us a bit more about Clear, because I understand Clear, it's got elements of chiropractic, to be honest, some aspects which aren't as much chiropractic, but it's something that's very helpful for scoliosis. Can you tell people more about that?
Okay, so Clear Institute, it's actually started I believe in the year 2000. And the founder is Dr. Dennis Wogan. He's in the US. He's from Minnesota. He's also a chiropractor. So he's been treating scoliosis. Well, he's been a chiropractor since 1978. Correct me if I'm wrong. He's been dealing with scoliosis ever since. And Clear Institute is developing a way of treatment to do a non-invasive type of exercise-based scoliosis treatment. So it is not just a manual adjustment to the spine, but we also implement changing of every patient movements, every patient daily activity, so they can reboot their brain when they are doing their daily activity. For example, if I have scoliosis, if I have for example, a C-curve type of scoliosis that lean to the right side. So most of the time when I'm walking, when I'm lifting something, when I'm sitting, I always need to lean to the right, because in my brain, that's normal. I'm sitting or standing straight. Now, Clear implement a specific type of treatment to re-educate our daily activity. So basically, we by giving a specific way of sitting, we have a special chair to change that. We also have special exercise to do that. By changing that, we're going to realign the spine and also re-educate the subconscious involuntary muscle inside our body. Now, by doing that, step by step, the scoliosis curve will starting to reduce, and then our posture will starting to change. Now, if someone with a 70-degree curve, of course, it's really hard to reduce it to zero. But if we can change their well-being and also improve their daily activity, and without going through surgery, I think that's considered a success. And that's how I feel that what I learned from Clear, it's not just Clear method, also other type of scoliosis method that I'm learning. It will help give another way for scoliosis patient to improve.
You mentioned about other methods and techniques. I know something that's used by a lot of chiropractors or something similar in Singapore is CBP. Is there a particular reason why you chose, say, Clear over CBP or any other methods?
I learned just a little bit of CBP method technique in my school. Uh, I actually learned clear after I graduated. I noticed it's very unorthodox. So basically, the method is really forcing the spine to change in a short period of time. So it's once I starting to learn that, and oh wow, it's not the changes can be improved significantly within a short period of time. So that's how I stress on the clear method more than CBP, and maybe because I also familiar with the clear method, that's why I chose this type of treatment. And I also receive a lot of patients from outside the country, outside Singapore, and I cannot treat a scoliosis type of case, for example, from someone from Indonesia, and then they have to be here for 3-4 months or even 6 months. It's very impossible. But using the clear method, I can treat this type of condition in maybe about 2 weeks times, and then they starting to have improvement, and all we have to do is just to maintain that improvement.
So tell me more about the 2-week intensives then. So what would be, say, a normal day, and then what kind of changes could be expected within those 2 weeks?
Okay, so if I receive a 2 weeks type of a treatment, I call this treatment an intensive scoliosis treatment. The reason we said intensive is because each patient will be with me for the whole day. So if I receive, for example, a 40-degree scoliosis patient, and they will start, it's sort of like exercise type of treatment. So they'll come in at 9 a.m. They'll do different type of exercises as well as stretching. So the exercise, clear exercise is actually divided into 3 phases. We call it mix, fix, and set. So the mixing part is where the patient will starting to learn how to stretch properly, whether it's using active movements or even passive movements. Now the passive movement, we have developed specific equipment to treat scoliosis patient. So we're going to utilize all these equipment, and then along with that, then I will do a specific adjustment according to the patient X-ray structure. So we're gonna prior to the treatment, we're gonna take a 3D X-ray, and then after that, we will do what we call neuromuscular reeducation. So the neuromuscular reeducation is to change the understanding of the patient's posture. So when patient doing that, then slowly we're gonna start to be able to develop a new posture and a new understanding about their proprioceptor. Proprioceptor is more like how we understand about our surrounding. So patient will do that for the whole day. Each day there's gonna be 2 sessions, and then we're gonna do that for 14 days. Now, within that 14 days, see, for example, that patient have about 40-degree scoliosis, I expect patient will have reduction for at least 30 to 40% reduction. So we can try to reduce it to about 20 to 25 degree. Now, of course, the changes can be significant if the patient is committed to the treatment. If the patient is not committed, then there's another story.
So if we go back a little bit, sorry, one thing I was wondering is, why did you actually decide to become a chiropractor? What led you into this profession?
Well, good question. I was a patient as well. So back in college, back in US, I was a biology major, and I was deciding to become a medical doctor. But at that time, I live in California, And California is the weather is very nice, but unfortunately during the spring season, we always get this pollens, and like millions of other people that live in California, I also get the hay fever. Dry nose, dry throat, runny nose, itchy eyes, and that's always my case. Back then, I was high on taking over-the-counter medication, antihistamine. I went to doctors regularly just to get prescription medication. Even one of the doctor diagnosed me with chronic bronchitis. So I even try traditional Chinese medicine, which I felt the improvement, but it's only temporary. Every time the spring season coming, then I will get the same problems. So when I was at Cal Poly Pomona, so my school is the area is pretty big. They're also having a agricultural area that deal with horses. So I get a lot of pollens, and doesn't matter if I cover my eyes with goggles, cover my nose and my mouth with the mask, I still get the side effect. So the pollen have some ways to go into my body. So one of my professor told me, "Hey, why don't you try chiropractic?" What is that? I have no idea what that means. So I just, okay, let me just find a chiropractor. So I went to one of the chiropractor he recommended. So before we start, definitely I get the explanation about human anatomy and the connection between our spine, our respiratory system, our immune system very thoroughly. So long story short, I went to a few sessions of chiropractic treatment, and during the next spring season, I noticed that I don't experience wheezing. I don't experience shortness of breath. I feel like I can breathe better. And then, so I asked my chiropractor, what's going on with, how come suddenly without taking any medication, I can improve and I don't feel that symptoms. So the chiropractor said that, yeah, if your body function optimally, especially in the upper cervical area, then your immune system will improve. And then it is not a matter of the spine, it's actually a matter of the central nervous system that able to function optimally. So from that point, I start to become a believer. And so I ditched my way to become a medical doctor. So, sign up for chiropractic school. Then, I'm here now.
I get it. That's one of the things that attracted me to upper cervical as well.
Yeah.
Partly the logical, for me, the philosophical side, but also kind of looking back on cases I had in the past and all the bigger changes, whether it's something like autism or blood pressure improving or tachycardia,
Yes,
or
exactly.
stomach problems. It kind of was stemming in that particular region as well. So since that point, of course, of graduating and to where you are now, what have been some of your big challenges?
Well, I do have a lot of challenges.
How about for doing scoliosis care in Singapore? How have the challenges been in that respect? Has it been different than, say, in Indonesia?
It's a bit different, yeah. But I would consider all scoliosis case is very challenging, because even the smallest curve of scoliosis case, because there is no scoliosis curve that will react the same way, because every part of the curve of the spine is also related to the nervous system. It's also related to the muscle function, and it's very much each individual scoliosis need to be treated using a custom exercise. I need to understand the movement of the patient. I need to understand what he or she can or cannot do, so I can build a custom treatment for that. Now, when I was practicing in Indonesia, I do have a my biggest challenge was a 159-degree scoliosis curve, which extremely hard to treat. I did able to reduce slightly, maybe about 20 degree, but again, it's still over 100 degree. Before I actually treat the patient, I also talk to the parents. I don't want them to, I just want to be transparent with the parents that, we try our best to treat this kid. And then also, I don't want them to keep their hopes high. Yeah. Just trust the process, and then also support the process of the treatment of your son. It's a boy. So he's actually improving. In the beginning, he's actually having trouble breathing because the 159-degree curve is actually compressing his lung and the heart. But after I would say about a few months of treatment, he's actually starting to be able to stand up correctly. He's able to breathe better. The lung is less compressed, and he can actually have more appetite. Because of that compression, he's also have less appetite when he's eating. So I noticed his weight changes, he's happier. So for me, the challenge is, as long as we can change the understanding about the notion of scoliosis, because scoliosis itself is a symptom. If we can understand, tell the parents, tell the patient that, you know what, we're dealing with a symptom. If we can change the root cause of the problem and make you improve your well-being, I think that's, for me, it's a challenge that I can face.
Okay. And you mentioned about, of course, a lot of children that you've been seeing, or young adults.
Yeah.
What are the common traits of the people you see? Is there particular common age groups that you see? Of course, scoliosis is one of the main conditions, but what other commonalities are there in your patients?
My youngest patient is 3 months old, and my oldest is 90 years old. And for me, all ages, I try to treat all ages. And then I also try to help everyone. But my main focus for all of them are changing their posture. It doesn't matter whether they're having neck pain, back pain, knee pain, ankle pain, even scoliosis. If we can improve their posture, they will start having improvement as well. So it is not just getting rid of the symptoms, but rehabilitate and try to change that posture permanently, so they will not experience the symptom again.
And I know for yourself, of course, generally you have quite a busy list of people, whether they're coming from Singapore, coming from other neighboring countries. What do you think are some of the most important factors of your success?
Good question. I had experienced a high volume practice. I had experienced a lot of challenges as I mature. So I think the most important factor is to be honest and to be humble and focused towards patient improvement and well-being. I think success is it's up to the patient to to grade us. Um, if I can accomplish and then help this patient having a better life, having a better activities or whatever that is, then that consider a success. We all long for daily joy and fulfillment in our work and beyond.
Absolutely, absolutely. And so what kind of goals do you have for either your practice at the moment or, of course, the profession in whole, as a whole?
Well, first, I'm glad that I practice in Singapore, and I'm glad that chiropractic profession is accepted in Singapore. I'm hoping that other profession also understand that condition, for example, such as scoliosis, can be improved through non-invasive approach such as exercise-based scoliosis treatment. Because each profession have their own specialty. It's important for healthcare provider in Singapore, even all over the world, to work hand in hand, work in harmony, so we can improve every single person to reach their optimal health and well-being.
And in an ideal world, then, what kind of changes would you like to see in the general healthcare system, either here in the States or in other countries?
You mean during this lockdown?
I mean, in general.
In general, okay.
The lockdown has, or the circuit breaker has made a very special situation for everybody.
Yes, definitely. So for me, I'm hoping that since chiropractic has been accepted all over the world, I'm hoping that Singapore in general, especially, can make chiropractic as part of the essential healthcare, because we treat a lot of patients, we treat a lot of condition,